Hello, everyone. I'm going to talk to you today about the ultrasound imaging of neonatal vascular anomalies. I have no financial disclosures. Vascular anomalies are a heterogeneous group of clinically and pathologically distinct abnormalities that are frequently misdiagnosed since inaccurate nomenclature and classification have led to inappropriate treatment in many patients. Recent advances in the understanding of the behavior and the underlying genetics of many of these lesions has increased the possibility for evaluation and implementation of appropriate therapies. I will review the classification of vascular anomalies with you, as well as discuss the diagnostic imaging features of some of the most important vascular anomalies presenting in the prenatal and neonatal periods. Vascular anomalies can be divided into two broad groups: tumors, which are characterized by endothelial hyperplasia, and malformations, which are characterized by vascular dysmorphogenesis and a normal endothelial cell turnover. Vascular anomalies usually present in childhood as a cutaneous lesion or as a deeper, palpable soft tissue mass. The clinical manifestations are related to localized or systemic influence of the primary lesion or malformative association or syndrome, such as limb overgrowth or coagulopathy. The International Society for the Study of Vascular Anomalies, or ISVA classification of 2018, is the most widely accepted classification worldwide. And vascular tumors are divided into benign, locally aggressive, or borderline or malignant forms, and the malformations into simple, combined, of major named vessels, or associated with other anomalies. The most important vascular neoplasms of the benign group consist of hemangioma of either the infantile or congenital forms, and the congenital forms are subdivided into the so-called riche or rapidly involuting congenital hemangioma, niche or non-involuting, and the piche or partially involuting congenital hemangiomas. The most important of the locally aggressive or borderline vascular neoplasms is the hemangioendothelioma, and of the malignant tumors, angiosarcoma. Vascular malformations can be composed of capillary, lymphatic, or venous vessels. They can include arterial and venous components. Arteriovenous fistula is a subgroup of vascular malformations, and there can be malformations that combine a number of these different types of vessels.